On the anniversary of Hurricane Maria, I went to Puerto Rico and met Gladys. Gladys has diabetes and manages her blood sugar with insulin. Following the storm, she relied on her brother to go to town every day to buy ice to keep her insulin cold. He wasn't always available, the lines were hours long, and the ice was scarce and expensive. Her insulin spoiled twice, and Gladys was hospitalized twice. On the second occasion, she slipped into a coma. This resulted in thousands of dollars in medical bills, but more importantly, severely damaged her health and threatened her life. Stories like Gladys's are not uncommon, and it's with stories like these in mind that we started building our company. My name is Mason Lusich, co-founder and CEO of INSU Health Design, and our goal is to provide all insulin users a reliable means of storing their insulin independently from the power grid, friends, family, and ice packs. Our first product is INSU Portable, the battery-powered insulin preservation system. No matter where or when, our users' vital medicine will be readily available and secure. We do have competition in this space, but in reality, no real good product exists. They don't get cold enough, they're far too expensive or large, and don't last longer than even 8 hours. With the technology we developed at the University of Houston, INSU Portable offers a 5 to 30-day battery life, can hold up to a 6-month supply of insulin, and can be charged through the wall, your car, or with a $15 solar panel. Now, because our competition is not meaningfully solving this problem, our advancement allows us to offer massive potential savings in diabetes spending on insulin users. Every year in the United States, an estimated $1.5 billion is spent on spoiled insulin, with $2.1 billion spent on the treatment of diabetic ketoacidosis, the condition that landed Gladys in the hospital. This is a combined $3.6 billion in potential savings to insurance providers, hospitals, and the 8 million insulin users in the United States. With insurance reimbursement, those insulin users like Gladys can pick up our product from hospitals, clinics, or pharmacies, or directly through our website. For disaster sufferers and the less fortunate around the world, we are working to develop partnerships with organizations like FEMA, Médecins Sans Frontières, and Insulin for Life to get it in their hands. Our team's distinct backgrounds and experiences, paired with a united vision for our company, set us up with the rock-solid foundation necessary for success. On our advisory board sit 2 university professors, as well as Dr. Stephen Ponder, a pediatric endocrinologist, author, and diabetes educator of the year. With this team, we've started developing a bit of traction. We've got non-dilutive funding and mentorship through Red Labs, the VentureWell eTeams program, as well as Pre-18, a startup accelerator focused on science and technology advancement in Puerto Rico. We've also established a partnership with Insulin for Life, an organization that provides insulin around the world to those in need, and we will work with them on our first pilot next year. With their help and the help of organizations like them, we hope to reach a large number of the 100 million insulin users worldwide. Looking to the future, we have a field test set up for November of this year, with our pilot next year before full-scale manufacturing in 2021. Our secured grant funding and bootstrapping will get us into next year, with future grant funding and an eventual seed round pushing us through full-scale production. Our ask of you today is to please share our website and Facebook page with the insulin user in your life, and sign up for updates on our progress through our website or at our booth today. Lastly, if you or anyone you know has experience navigating insurance reimbursement pathways, please do reach out to us. Come stop by our booth and ask me any questions you may have, and thank you so much for sharing your time with us today as we work to preserve the time of insulin users the world over. Thank you.